Hi, I'm Dr. Andrew Vantreese. I'm the author of the book, How to Be a Winner, a lifestyle guide to achieving and maintaining health. I'm a chiropractor, and I practice brain-based therapy in Decatur, Georgia. Let me give you a little bit of my history. I was injured severely when I was 16 years old in a motor vehicle accident. I spent 3 days in the hospital in ICU. The steering wheel about came up and crushed my chest and separated all my ribs from my sternum, and I had a contusion on my heart. When I got out of the hospital, I'd laid for many months in a lazy boy recliner because I couldn't lay flat because it was excruciating pain. Eventually I went and I saw a chiropractor, and this made all the difference in my health and my well-being. It was at that moment that I decided to become a chiropractor myself. That led me to chiropractic school at Life University in Atlanta, Georgia. Now let me give you a little bit about the chiropractic philosophy that I learned while I was in school. Health comes from above, down, inside out, according to the chiropractic philosophy. And essentially what this is saying is that our brain controls every cell in our body, and that information travels from above down, from the inside out. I'm going to add a little bit to that. Health comes from the receptors in our body, above, down, inside out. That makes us a radio. Receptors, above, down, inside out. You see, our brain is constantly keeping track of the stimuli to the nervous system, and then sends the messages via the brain down through the spinal cord and out to the body. Chiropractic philosophy states that if we have a misalignment in our spine that interferes with this nervous impulse from our brain to our body, then our health is going to be compromised. And that's exactly right. And that's what I experienced with my experience with chiropractic care after my injury. The missing link to that problem, though, is that what if the brain's communications is dysfunctional? And that's what I found over many years of treating chiropractic patients. I've had great success, as have many patients with traditional chiropractic methods, but I got frustrated with these chronic cases I was having trouble fixing. So that led me to Dr. Johnson. Dr. Johnson is a board-certified chiropractic neurologist, and he wrote the book, What to Do When the Medications Don't Work, a non-drug treatment of dizziness, migraine headaches, fibromyalgia, and other chronic conditions. I've been trained by Dr. Michael Johnson, and I work directly with him. And the treatment that we use what's called brain-based therapy. So perhaps you've been exposed to chiropractic care. Let me tell you why this is a little bit different. With brain-based therapy, we're looking at the primary brain loop. And the way the brain talks to itself is the cerebellum talks to the cortex talks to the lower brainstem, and then the lower brainstem talks to the upper brainstem. This takes place via what's called the dentato-rubro-thalamic cortical pathway, and then the neocortical thalamo-hypothalamal pontomedullary reticular activating formation. Big fancy terms just means cerebellum talks to brain talks to brainstem talks to the upper brainstem. So what happens when this brain loop gets interfered with and we have dysfunction with our neurons in our brain is we can develop conditions like insomnia, migraine headaches, fibromyalgia, restless leg syndrome, fatigue. We can have certain things like irritable bowel syndrome. We can have tachycardia or arrhythmias in the heart, and I'll explain that a little bit later neurologically. But let me tell you what's going to be a little bit different in what you'll experience with a brain-based therapy exam that you might not have experienced with chiropractic before. We're going to check your blood pressure, and we're going to check it bilaterally. One of the reasons we want to check it bilaterally is typically blood pressure will be elevated on the side where there's a weakness in the brain. We're going to check your oxygen levels in your tissues. It's called tissue saturation of oxygen. We're also going to check the perfusion of that oxygen. How much is your blood flow? How's that doing? We're going to check your respiration to make sure that you have a normal breathing rate. If you breathe too much, then you're basically suffocating. You're trying to get air. We're going to test your salivary pH, which is going to talk to us about your oxygen levels. We're going to check your deep tendon reflexes, how you perceive vibration. We're going to test your sensory using what's called a pinwheel. We're going to test your muscle strength. This all gives us clues to how your brain is functioning. We're also going to do several cerebellum tests. Cerebellum is one of the most it is the most oxygen dependent organ in the entire body. And it is very critical in maintaining the health of our posture, our spine, and overall well-being. This is because the cerebellum controls and coordinates all postural movement and postural muscles. So any movement that you do in your body is controlled by your cerebellum. And your muscle spindle cells, your Golgi tendon organ bodies, and your joint mechanoreceptors via the dorsal spinal cerebellar tract are in constant communication with the cerebellum. So if we are misaligned, that's going to interfere with the cerebellum, which is going to interfere with that brain loop I talked about before. Okay? So what types of treatments do we do in a brain-based therapy office that set us apart from a typical or traditional chiropractic office? We're going to do unilateral adjustments. That means we're only going to adjust and align the body on one side. That stimulates up to the cerebellum like we talked before. And you want to do that if you're trying to correct the brain loop. We're going to do auditory stim, where we might just do sound in one ear. We're going to do TENS, transcutaneous electrical nerve stimulation, once again to stimulate mechanoreceptors up to that deficient cerebellum. We may do heat. We may do calorics. Calorics is putting warm water in the ear canal to hit the tympanic membrane and the semicircular canals. When you do that, you turn what's called endolymph within the semicircular canals, which is like jello, into a liquid, which stimulates stereocilia and kinocilia, hair cells within there, which then sends an impulse via the vestibular nerve to that deficient cerebellum. We're going to do oxygen therapy. Oxygen, like we said before, is extremely critical to the brain health. Your brain needs two things to survive. It needs fuel and it needs activation. Fuel comes in the form of oxygen and glucose. Glucose you get from your diet, and the diet does need to be refined perhaps, but it also comes from oxygen. And as we age, we go through a process called oxidative phosphorylation, where our body loses its ability to utilize oxygen. So we're going to give the body oxygen. We may do auricular therapy, which is basically an electric form of acupuncture that we're going to do to the ear to stimulate the pontomedullary region, the brainstem. We've got cold laser in our office, hydrotherapy, and we do spinal decompression for non-surgical treatment of bulging and herniated discs. All of this is what makes our office extremely different here. So, I hope you've enjoyed your introduction to brain-based therapy here, and I look forward to seeing you in the office and working with you and helping you experience life to its optimum. Don't just live, be well with well-beings.